Hello and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the AASLD. I'm Archita Desai. I'm an assistant professor of medicine at Indiana University and an associate editor with the CLD. I'm here with Dr. Kareen Akiva. She's an internal medicine resident at University of Maryland and the co-author of an important review on hepatitis D entitled Hepatitis D Virus, Epidemiology, Lifecycle, Testing, and Treatment. Dr. Hill, thanks for joining us. Why don't we start by getting an update on what is known about hepatitis D and the current epidemiology?
Okay, thank you for having me. So, hepatitis D is considered the most severe viral hepatitis with rapid progression towards liver-related death and hepatocellular carcinoma. To review, hepatitis D is enveloped by the hepatitis B envelope, which is how it allows the virus to attach and enter into host cells. The HDV virus activates the innate immune system, which is one of the key differences that set it apart between hepatitis B virus. Overall, since the implementation of the hepatitis B vaccination program, studies do show an overall decline in the incidence of hepatitis D virus in the developed world, where most cases of hepatitis D virus cases are detected in young immigrants who are coming from endemic regions. Even though there is a decline in the hepatitis D prevalence, due to increased migration and immigration, it's still really important to screen for hepatitis D.
Good. Well, can you give us an overview of who to screen for hepatitis D and current guidelines for testing?
So there are two different recommendations of who to test for hepatitis D. One of them comes from the European and the Asian Pacific Associations, who recommend a more aggressive screening to screen all individuals who are positive for hepatitis B surface antigen, while the American Association for Liver Disease recommends to screen only a certain subset of patients who are positive for hepatitis B antigen. And these are patients who were born in an endemic region, patients who were not vaccinated against hepatitis B virus and their parents are from endemic regions, patients who are intravenous drug users, men who have sex with men, or patients who have an unknown etiology for elevated AST and ALT. But in either case, the screening is done by looking for the anti-HDV antibody, and then this test is confirmed with a quantitative HDV RNA test.
The B and D are tricky, huh? Anyway, so let's talk about some non-invasive ways to stage hepatitis D once it's diagnosed in our patients, and how does that differ from viral hepatitis of other etiologies?
So the gold standard for diagnosing cirrhosis is a liver biopsy, but this is an invasive procedure and requires a special skill set in order to do it. And it's often not repeated to determine staging after the initial diagnosis. So there's multiple tests that were developed and validated using for staging of hepatitis C. But these tests or scores need further validation in hepatitis D. So FIB4, which is one score that includes a patient's age, AST, ALT, and the platelet count, was found to be a top performer for all of viral etiologies. But then in studies that looked at it alone in hepatitis D, it did not significantly outperform other clinical scores that were being used. There is one score that's currently being studied called the Delta-4 fibrosis score, and has shown promise in hepatitis D, but still needs to be validated. This score includes the liver stiffness that can be measured via vibration-controlled transient elastography, GGT, platelet count, and ALT.
Interesting. We'll have to look for that data. So as important as staging is treatment once it's diagnosed, can you tell us, Dr. Hill, about the status of treatment of hepatitis D?
Yeah, so the current recommendation for treatment for hepatitis D is the off-label use of pegylated interferon alpha, which is a subcutaneous injection. But this has not shown to treat all of the cases. There's actually a pretty wide range of who it will clear the hepatitis D virus for. So there are multiple other strategies that are in the pipeline in different stages of clinical trials, and these are further outlined in the article. So you'll have to go there to learn more about that.
Sure. Well, that was an excellent review. We certainly hope our readers will enjoy the written article. Thank you for joining us for another installment of Clinical Liver Disease video series. And to the audience, thank you for joining us. On behalf of all of us on the CLD team, I hope you found this update on hepatitis D useful. I know that it's a reminder to me to screen for it more often. For more information, please visit us at www.cldlearning.com. Thank you again for watching.